My name is Mark Nelson. I'm a physician's assistant. I'm in my 40th year of working in orthopedics here in Opelousas. I'm the father of three boys. I usually call them Mo, Curly, and Larry, but I won't today. My oldest is about to graduate from his primary care or family practice residency program in Shreveport. My middle son is a physician's assistant, and I hope he's a better one than I am. He works for an orthopedist, Dr. Faraci, in Baton Rouge. And my youngest is a physical therapist. So I have three children that can't really help me in fixing my car, air conditioner, plumbing, or anything. So I'm stuck with that. Anyway, my story is brief. My youngest son got married on 10/10/20 in Austin, Texas, in the middle of COVID. I was in good health, holding down a full-time job in orthopedics, taking call, and I had two side jobs. I worked urgent cares on weekends. I made rounds during the week and weekends for a physiatrist on rehab, and very active with bike ride. I'm a soccer referee, uh, 8 months out of the year for kids, high school age as well, and was just doing my thing. Went to Austin, moved furniture, did everything that needed to be done for the wedding, kept my son's dogs. 2 weeks later, they came to pick their dogs up. And, in the interim, every time they had a wedding back then, somebody would report, oh, such and such was there and had COVID. So, everybody was kind of on alert, but I didn't have any symptoms. So that Saturday night that they came, 2 weeks later, I woke up in the middle of the night short of breath. And it's the first time I'm not on any meds, never had high blood pressure. I've never smoked. I had no medical history. And I was just so short of breath, I couldn't catch my breath. It's the first time I ever told my wife, I said, Annette, I've got to go to the emergency room. I can't catch my breath. And she couldn't believe she heard that out of me. And I just assumed it had to be COVID. I mean, that's just what I assumed it was. So we ran to the emergency room about 3 a.m. And here at Opelousas General, the emergency room doctor did the COVID test on me, and it was negative. So he did a chest x-ray, had no pneumonia, but my heart was a little enlarged, which puzzled me a little bit. They did a BNP, which was extremely elevated. And so, different people coming in and out of the emergency room x-raying. I knew everybody there at the hospital, and I just kind of small talk with them. They ordered an echo. Well, I don't have any connections with any of those people. So he came in and he was doing my echo. And from my limited cardiology knowledge, I have to recertify every year and a little bit of everything. I knew a little bit about ejection fractions and what they should be. And I just casually asked him, hey, how's my ejection fraction? It's, probably what, 50 or 45, 50? And it was quiet. And he just said, it's less than 20. And I said, I mean, I don't know how to explain this heat feeling just went all over me because I was thinking, no, this is something serious. I said, can you check it again? Do I need to turn over? What do we need to do? We got to change that number. And he laughed. He kind of looked at it a different way. And he says, actually, it's less than that. And that was the start of my journey. Cardiologist came and saw me. They gave me 20 Lasix, and I was no longer short of breath. I was ready. Let me go home. I'm good. I'm cured. Let me go home. I was pretty much in denial. I don't want to have anything more to do with this. And they sent me home on some Entresto and some Lasix PRN and to see the cardiologist on Monday. I followed up with Dr. Sibi, an amazing cardiologist here in Opelousas, and he told me this is probably transient. I didn't look the part. I didn't have any of the risk factors. Hopefully goes away in several months, and it didn't. I continued to work full time. I still worked at the urgent care, and that was soccer season starting. So I was not able to keep up with play, and things were progressing, getting worse. I'd weigh myself every day, and I was slowly gaining weight. And it was very upsetting to me because I was really watching my salt and all the things I was to do, and nothing was helping. This continued through Thanksgiving and into December. I continued to work full time. In between cases, I go to the vendor lounge or my little lounge. I just elevate my legs, and I couldn't understand what was happening, but it was happening fast. This continued to occur throughout the month of December. I would come home from work and just have to elevate my legs. I was starting to get edema. I mean, all the way up to my hip. I could have pitting edema on my greater trochanter. I started even having it in my upper extremities. And late December, I was placed in the hospital and put me on some Lasix. And at that time, and I wished I could remember the name of that drug. I'm sure the doctors know it. It's one of those that helps your heart pump harder. And they then had to put a PICC line in me, and I had to have a life vest, which I don't wish on anybody. Oh my goodness gracious. So that was when it really started getting difficult for me. I continued to work through the month of December. They worked me up. I did a heart cath. I had plenty good blood flow to my heart. So I was diagnosed with non-ischemic idiopathic cardiomyopathy. Wow. So as I continued to decline, I needed to have, with my PICC line, my wife would help sponge bathe me, and I started losing my independence, which was a very, very hard thing for me to swallow. And I always will remember that feeling, because it makes me to appreciate where I am today. So anyway, I continued to kind of decline, and in early January, Dr. Sibby told me that there was nothing else he could do for me, and he was going to have to move me on to Ochsner, where he had trained. And he made a couple phone calls and said, look, you need to set up to get in there and be seen. So I cleared things with my insurance. About a week later, I went there. I saw Dr. Eisworth for my initial exam. He did a real thorough exam, and he said I needed to be put in the hospital immediately. And it was all starting to become very real to me. I was admitted that night, and I learned Ochsner knows how to diuresia. 40 milligrams of Lasix Q hour around the clock. I lost 52 pounds of fluid in 3 days. I was doing jumping jacks, ready to go back to work. Let me get back to work. I'll come back. We can do this every once in a while. How's that sound? And they didn't buy that. So they can, continue to work me up. I guess my EF was getting less and less. I went through all the workup, all the CT scans, the ultrasounds, the pulmonary function test, and everything looked good. I had no other end-stage organ damage at all. So they had their grand rounds, and they came into the room that one day, and they said, look, we've decided to move you on straight to transplant. And I'm still trying to grasp what's happening to me, because I just didn't understand what was happening. So they also said that I need to have some implantable pumps, to help the heart pump and keep me going. That was done. I was taken very good care of me in the ICU there on the 6th floor. I made some very nice relationships with all those special people. Unfortunately, things continued to decline. They had to take out one pump, put in another one. Then that one was starting to cause some hemolysis. So they had to take that pump out, put in another one. And I was losing weight. My appetite was really going down, and it was just not looking good. They obviously told me I had the option of an LVAD, and I realized that my style of life, I mean, it would keep me alive, but I just didn't want that. You can't take a shower. You lose a lot of independence. In South Louisiana, you're going to sweat. I wanted to still be active, and I'll never forget. So the Saturday, February 6th, I was on maximum doses of all the medications to keep my heart pumping. And obviously the side effect, as you all know, are arrhythmias. So I went into supraventricular tachycardia. Everybody runs in the room. I'm like, what's going on? You're in, my heart rate was 180. We're going to cardiovert you. And I went, wait a minute, you're not going to shock me, are you? And they said, no. I went, okay, good. But they were all in there practicing like it's going to be a code. I'm like, man, this is going to be serious. So they gave me the adenosine, and I felt fine. My heart rate, you listen to your heart rate go down to 0. That's a weird thing to have happen. You're hearing it go, stops, and it goes back up. You're like, man, whew. They had to do that 3 times that day. 3 times. I mean, I was ready to help them push the adenosine. I knew everything that was going on. And so they had to then put me on amiodarone, which I didn't like the feeling that gave me either, but it was getting between a rock and a hard spot fast. The next day, I was told my numbers looked a little bit better. So Monday morning, I almost call her a saint. Dr. Desai came in the room and told me things didn't look good, that I looked like I was going to be scheduled to have an LVAD, and I begged for some more time to wait for a heart. And she talked to the cardiovascular surgeon, and she came in that Tuesday morning, February 9th, and said they'd give me 4 days. 4 days. And at that time, I had to have the LVAD, and that if my heart continued to decline, I may have to have the LVAD prior to that. Well, I got up and walked with therapy. I went back, sat in a chair. I had Annette put me back in bed. And after about 5 minutes, I said, Annette, I give up. I'll sign the paperwork. I'll have the LVAD. There's no hope. And she came to my side and she said, we're not quitting. I've told this story a million times. I can't get through. Anyway, she said, we're not quitting. We're not going to give up. We're going to keep praying. We're going to take every minute they give us. I said, you know, you're right. That's what we're going to do. 2 hours later, Dr. Desai came back in the room with all her entourage. And told me they had a heart for me and it was a perfect match. I'd be having surgery the next day. What can you say? I was taken on the gurney back to the OR the next day. And I said, I've dreamt of these lights going over my head on the way to the operating room to have this happen. And I got scooted over from the gurney onto the OR table. I live in the OR. I work in the OR every day of my life. I thanked everybody for what they were about to do. I laid down and got put to sleep, and I was extubated actually the next day. And I've never looked back. I have never looked back. I had a good friend of mine, fortunately lived in New Orleans. So after my about 14-day stay in the hospital and several right-sided heart biopsies, I went to his house and I walked as far as I could every day. I went back to Ochsner each week, and they kept saying, Mr. Nelson, you cannot ask when you want to go back to work. I'm not going to ask. You brought it up, but I'm ready to get back to work. And they said, they laughed. They said, you know, people 6 weeks post-op having their chest open or trying to get on disability, and you're wanting to go to work? I said, yes, sir. That's what all this was done for. I'm ready to be back and be productive again. And at 8 weeks post-op, I was back to work. It wore me out, but I didn't care. I was back to work. I have to give. I don't have a good day unless I am productive for other people. And that I needed to have that psychologically. And then I just continued to recover gradually. They just would shake their head at Ochsner. And I realized, you know, somebody mentioned a fellow that I saw last couple weeks ago for my yearly checkup said, Mr. Nelson, you are an outlier. And he wouldn't call me an out and out liar, but an outlier. And, you know, he said, you know, you didn't have that end stage renal disease. You didn't have that congestive heart failure for years. You know, it was all very, very acute for you. And I said, I understand that. That's why I understand that so many other people have suffered and have had such a harder road to hoe than I have. And so I was very, very fortunate. And it's, you know, I will not compare myself to any of them. So many people had to have the LVAD. Maybe an LVAD failed. They had to have a second LVAD, and then they maybe got a heart. And so, I mean, those are the people that need the pat on the back. I deserve no pat on the back. But you know, after that, I did well, but I didn't understand everything that had happened to me. You really finally have time to realize it's different when you go in and get a gallbladder taken out and you go home and that's that and you know who to thank. All of a sudden, I realized this was a huge operation of many people working like a Swiss watch to make everything happen. And then I wanted to go back and try to touch base with each and every one of them and tell them thank you. I was able to make contact with my donor family, a little family out of a little town outside Orlando, Florida. And once I got their contact number, to this day, I call them and talk to the mom every single Monday. She treats me like her son. I don't know how to explain this to you. Did you have a good day at work? How much did you do today? Are you going to do soccer? Don't do too much. You're going to be tired. You can eat a good supper when you get home? Yes, ma'am. Yes, ma'am. Will you get your rest? Yes, ma'am. And you know, I accept that, and I'm gonna do everything I can for her to feel like she's still talking to her son. I flew them to South Louisiana this past October, picked them up in New Orleans, brought them home to I live in Grand Coteau Sunset, south of Opelousas. I took them to the best po' boy shop in Lafayette, Old Time Grocery, had them to eat a great po' boy. I took them to Bro Bridge to a Zodigo breakfast. They danced Zodigo. I danced with them. We watched some football. We shared some tears. And, and a lot of laughs. And we became a family, them with us and us with them. And, the next time we get together, it won't be quite as tough. I didn't want to, I didn't want them to go through the story. I didn't want them to have any pain going back through that. And I don't think they did, but I think I've been able to kind of ease a little bit of their pain. It'll never be taken away. And, it was some special time. Like I said, every Monday I make it a point to talk to them. And for the opportunity today for me to sincerely thank you all for what you do, um, gives me some gratitude. It makes me feel good to be able to thank you all, because you all had a part in it. Maybe it was for somebody else from somewhere else, but I probably wouldn't be here 2 years later if it weren't for people like you all. So thank you, and I hope I haven't taken up too much of your time.